Have you ever felt constantly worried, stressed, and anxious? That's why we present the ebook Calm Your Mind: 10 Proven Strategies to Conquer Anxiety. With an evidence-based approach and proven strategies, this guide will help you eliminate anxiety symptoms and find emotional balance. And the best part, this guide is easy to understand and implement in your daily routine, so you can start feeling the benefits immediately. Click on the link in the first pinned comment and get immediate access to your ultimate guide to emotional well-being.
Hello everyone, in today's video, we will talk about the importance of vitamin D and its health benefits. Vitamin D is a fat-soluble vitamin, which means that it is soluble in fat and can be stored in the body's adipose tissue. Vitamin D is important for maintaining bone health because it helps in the absorption of calcium and phosphorus in the intestine, as well as promoting bone mineralization. The main source of vitamin D is sun exposure, as the sun's UVB rays stimulate the production of vitamin D in the skin. Foods such as fatty fish, egg yolks, and fortified milk can also provide vitamin D. However, it is important to note that the amount of vitamin D present in foods is generally low and may not be enough to meet the body's daily needs. Therefore, sun exposure is considered the primary source of vitamin D for most people. Now, let's move on to the health benefits of vitamin D. Strengthening of bones and prevention of bone diseases. Vitamin D helps in the absorption of calcium and phosphorus, which are essential for bone health. Maintaining adequate levels of vitamin D can help prevent bone diseases such as osteoporosis and rickets, which can lead to fractures and debility. Regulation of the immune system. Vitamin D helps regulate immune function, reducing the risk of inflammation and autoimmune diseases such as type 1 diabetes and rheumatoid arthritis. In addition, vitamin D can help prevent infections such as the flu and colds. Improvement of cardiovascular health. Vitamin D helps to reduce blood pressure and regulate the metabolism of fats in the blood. This can help prevent cardiovascular diseases such as hypertension and atherosclerosis. Vitamin D deficiency. Many people may have a deficiency of vitamin D, which can lead to a range of health problems. Let's better understand how this happens. Causes of vitamin D deficiency. The main cause of vitamin D deficiency is lack of sun exposure. This can occur in regions with little sunlight, in people who wear clothing that covers the entire body, or in people who work in indoor environments all day. In addition, a diet poor in vitamin D can also contribute to deficiency. Symptoms of vitamin D deficiency. Vitamin D deficiency can lead to a range of symptoms, such as muscle weakness, bone pain, fatigue, low immunity, sleep problems, and depression. In children, vitamin D deficiency can lead to rickets, a condition that affects bone growth and development. Effects of vitamin D deficiency on health. Vitamin D deficiency can lead to a range of health problems, including osteoporosis, osteomalacia, cardiovascular problems, type 2 diabetes, autoimmune diseases, and cancer. Reduction of cancer risk. Vitamin D has antioxidant properties and helps to reduce inflammation, which can prevent the growth of cancer cells. Studies suggest that adequate levels of vitamin D can reduce the risk of breast, prostate, and colon cancer. Regulation of mood and prevention of mental illness. Vitamin D is involved in the regulation of neurotransmitters, such as serotonin, which affect mood and mental health. Studies suggest that adequate levels of vitamin D may help prevent mental illnesses, such as depression and schizophrenia. In summary, maintaining adequate levels of vitamin D can help prevent a range of illnesses and promote overall bodily health. Therefore, it is important to ensure adequate sun exposure and a balanced diet to obtain the necessary amount of vitamin D. Always consult a doctor or nutritionist to check if you are getting the ideal amount of vitamin D and if supplementation is necessary. How to treat vitamin D deficiency. Vitamin D deficiency can be diagnosed through a blood test that measures vitamin levels in the body. Treatment of deficiency usually involves vitamin D supplementation, as well as changes in diet and adequate sun exposure. Prevention of vitamin D deficiency. To prevent vitamin D deficiency, it is important to ensure adequate sun exposure, especially during peak sunlight hours, as well as consume vitamin D-rich foods, such as fatty fish, egg yolks, and fortified milk. In some cases, supplementation may be recommended to ensure adequate levels of vitamin D. How to supplement vitamin D. Identifying deficiency. The first step to supplementing vitamin D is to identify whether you have a deficiency or insufficiency of this vitamin in your body. For this, it is necessary to have a blood test and check vitamin D levels. Recommended dosage. After identifying deficiency, the next step is to determine the appropriate dosage of vitamin D for supplementation. The dosage may vary according to age, weight, and vitamin D levels in the body. It is important to consult a health professional to determine the ideal dosage. Choosing the supplement. There are various forms of vitamin D supplementation, including capsules, tablets, drops, and even foods fortified with the vitamin. It is important to choose a quality supplement, preferably with Anvisa approval. Best times and ways to consume. Vitamin D can be consumed at any time of day, with or without food. However, it is recommended to consume vitamin D with fatty foods, as vitamin D is a fat-soluble vitamin. It is also important to avoid excessive consumption of supplements, as this can lead to vitamin D toxicity. We have reached the end of this video about vitamin D. We have seen how important this vitamin is for bone, immune, and overall bodily health. In addition, we have learned about the benefits of vitamin D, which include prevention of chronic diseases, improvement of cognitive and muscular function, and reduction of the risk of falls and fractures in the elderly. For people who cannot obtain sufficient vitamin D through diet or sun exposure, supplementation may be an important option. However, it is important to remember that supplementation should be accompanied by a healthcare professional and combined with a healthy diet and adequate sun exposure. Sign up for our channel and live in focus. Don't miss any of our videos with tips and inspiration for you to live your life to the fullest. Click on subscribe and turn on notifications to stay updated with our new videos.